Fab. So thank you so much everyone for joining this lunchtime. My laptop seems to be having a bit of a wobble, so fingers crossed it lasts throughout the lunchtime, but if not, we'll play it by ear. So today we've got about an hour to think about sort of the speech language communication needs of young people in the criminal justice system. I could talk for hours and hours about it, but we're going to focus sort of specifically on traumatic brain injury, trauma and attachment, and the impact that some of those have on communication. And then think about, how can a young person navigate the criminal justice system if they have speech, language or communication needs? And then what specifically the role of a speech language therapist is in the criminal justice system. Next slide.
Sorry, Lauren, I'm really trying to move the slides on, but my laptop is not behaving itself well. Okay, I might just have to skip out and skip back in again. Okay.
Do you want me to put it online?
Yeah, let's try that.
There we go. Is that working okay?
Yep, that's perfect. Thank you, Lauren.
Okay, so I work at HMYY Warrington. So that is a young offenders prison for boys aged between 15 to 18. And we typically take boys from around the Midlands area, but can take boys from a wider catchment area as well if needed. So boys typically come on remand, so that means they've not yet been found guilty of the crime they're charged with, and are still sort of waiting to go to court, or they may be sentenced. So some boys may come to Warrington, do their sentence and then leave again. Other boys may have a longer sentence, so we do have some boys who are in for life, so they will then move on to an adult prison. So we have capacity for around 120 young people. At the minute, sort of numbers are quite low, so we have around 60 boys with us at the minute. The picture you can see here is our main location, so that is the Dalton unit. So we have 2 wings over 2 floors, and then we also have the Denver unit as well. So that is formed of our wage unit, which is a unit for boys who require an additional level of support, really. So that may be that they have some behavioural needs and need an extra level of support to reintegrate back to the main unit. And then we have our diamond unit. So that is for boys who have a sort of enhanced status privileges. Oh, just checking the chat there.
It might just be a problem for that person. I'll just suggest that they leave and rejoin, so don't worry about it.
So I work within the Integrated Mental Health and Substance Misuse team. So we are an NHS team and include mental health nurses, a drama therapist. We have substance misuse workers and clinical psychologists. But then within the wider prison, we also have social workers, forensic psychologists, we have an education department and chaplaincy. So a lot of professionals really working to support the boys that we have at the establishment. So when I first got this job, a lot of people said to me, sort of, why do they need a speech therapist there? Surely they can all talk. Don't you just work with kids with lisps and stammers? And then on sort of my first week there, I was going around the prison and a lot of the officers were saying, oh, you can teach me to talk, or he needs elocution lessons. So there's not sort of a great deal of understanding at the minute, I'd say, about why speech therapy is needed in prisons. And hopefully as we go through today, we'll sort of think about that a bit more. So just so sort of we're all on the same page really, when we talk about speech, language and communication needs, we're thinking about speech. So that may be somebody with a stammer, or it may be somebody who has had a cleft lip and palate and they may have difficulty making the sounds needed in their speech. It may be that somebody has receptive and expressive language difficulties, so difficulty sort of understanding language or using words to form their sentences. And then we've got communication. So that's putting everything together to really, talk to other people, to express our needs in a way that others can understand. And what we really often see is that surface level behaviour. So quite often, we will see somebody kicking off. They may be sort of labelled as aggressive or naughty. And what we don't see is under the surface is those speech, language and communication needs. So actually, somebody may be feeling really frustrated about something and they haven't got the ability to express that successfully. So when it comes to identifying needs in a youth offending setting, these children often haven't had their needs previously recognised. There's a handful of boys really who come in who have ever had any involvement with speech and language therapy, but actually have got a huge level of need. So we do screen everybody on arrival for speech, language, communication needs, and this is done through the Chat 5. So that's used across all sort of YOI settings. It is only a screen, and it is completed by sort of any member of our team. So, it isn't perfect, but is a starting point to try and sort of identify some of these boys who may have communication needs. Some people will come in with an educational health care plan. The difficulty I say with that is that quite often these boys have not been in education for a number of years, and therefore, their plan may not be as up to date and as sort of reflective of their current needs, really. The other assessments that I've done are through education, so they do a whole range of different assessments looking at their sort of levels and ability. Okay, so thinking sort of about what communication needs we see in the criminal justice system, figures do vary. They estimate that between sort of 60 to 80% of people involved in the criminal justice system do have speech, language and communication needs. And what we see is that of those who come in with an AHCP with social, emotional and mental health needs listed, quite often there's no sort of mention of communication, and a speech and language therapist hasn't been involved previously, but actually 81% of children with sort of SEMH needs have unidentified speech, language and communication needs. What we also see is that mental health difficulties and neurodiversity are far more common in young people in custody than in the general population. And unfortunately, a lot of sort of these needs are undiagnosed, and actually coming into prison is an opportunity to have a need identified. So we have some boys who have recently been diagnosed with a learning disability or autism and ADHD. So 23 to 32% do have a diagnosed learning disability. But again, there is a proportion who are currently undiagnosed and probably do have a level of need, really. So one thing to sort of bear in mind as we go through this is a model that I really like. So it's the compounding risk model. And that's sort of the idea that young people may have decreased oral language skills. And for somebody with, decreased language, that then puts them at risk of having literacy difficulties. If you're somebody with literacy difficulties, that makes education really, really difficult. So many of the boys that I speak to will say, I hated school, I couldn't do it. They've not been in education for a number of years. And they say, oh, it was so hard. I would ask for help and not necessarily get the right support that I needed. And for those boys, it's easier just to mess about or to kick off, because they're finding that work really, really hard. And often, those difficulties around language haven't been identified. And what we see, going back to that iceberg model, is that behaviour on the surface, and they get that label of sort of a naughty child, who is at risk of exclusion, unfortunately. So somebody with language difficulties are also at risk of then developing mental health and behavioural, sort of poor behavioural outcomes, and sort of going on to a risk of offending as well. So I have pinched this from Emma because I really like it. So I think Emma Bowers has done some really good presentations sort of earlier on. And it just sort of shows that it's such a complex web, really, of difficulties and risks. Because, if somebody has got speech language communication needs, that puts them at risk of sort of social, emotional, mental health needs. But equally, somebody with social, emotional, mental health needs is at risk of having speech language communication needs. And they're so sort of closely linked that really, instead of focusing on, the diagnosis, it's really important that we just look at that individual holistically and look at what their needs are and address those, really. Okay. So we'll move on to thinking about traumatic brain injury and the criminal justice system. So these figures, again, vary. It's estimated that somewhere between 30% to 65% of young people in the criminal justice system have a history of traumatic brain injury. And that often those who have sort of sustained multiple injuries then have that cumulative impact of a more sort of significant injury. Young offenders with a history of TBI are then more likely to go on to commit a serious violent crime. And that those who acquired their head injury younger than 12 were found to have committed crimes significantly earlier than those who acquired a head injury later in life. What I will say is that often, these injuries aren't necessarily documented or considered to be a significant head injury, and therefore, there's limited information available, or a young person may not consider that to be sort of significant when you're talking to them. And what we find is that risk-taking individuals are at greater risk of engaging in thrill-seeking behaviours where injury is more likely. And actually, a 16-year-old is at that stage in their life where, they are likely to take risks and engage in some of that behaviour. And that if you are involved in crime, that is going to put you in a situation where injury, is more probable. Gang culture at the minute sort of is massive. There's a lot of people who, have got into trouble with, gangs and may end up sort of, receiving a blow to the head for whatever reason from a rival gang. And I think the other thing to note is that if somebody has sustained a TBI, they are then more likely to go on and have further TBIs because of some of that sort of risk-taking, impulse control difficulties that we'll talk about a bit later on. So when we think about TBI and speech language communication needs, somebody who has a TBI may then have a cognitive communication difficulty. So this is a result from cognitive changes. So it may be an injury to the frontal lobe, and that can then have an impact on communication. So it may be that somebody has difficulties with their attention or memory, and quite often sort of their problem-solving skills. So that may mean that they sort of struggle to pay attention in conversation, or they may not remember what has been said to them, and that then lends itself to communication breakdowns later on. What is also really common is a decreased awareness of their own and others' emotional state. They may have poor impulse control or sort of social judgments. And sometimes that can lead to breaking those sort of social norms, those social rules, which when you're in a young offenders environment, you've got teenagers who are already very impulsive, that can lead to some sometimes sort of ill-considered responses, and an increased likelihood of more sort of violence happening. So it is a little bit of a whistle-stop tour, this, I'm afraid. I'm going to move on to speech-language communication needs and social, emotional, mental health needs. So SEMH needs are a type of special educational needs where a child will communicate through their behaviour in response to an unmet social, emotional and mental health need. For the boys that we have in the establishment with an EHCP plan, SEMH, I'd say, is the most common documented need that these boys have. So they may have difficulty with their emotional and social development, sometimes find it really hard to make and sustain healthy relationships. And often, it's easy to become involved in a gang when, sometimes verbal communication isn't necessary, and they may rely on sort of hand gestures and all sorts of other complexities, really. So these needs can be influenced by trauma, attachment, and complex family dynamics, which we will have a bit of a look at now. Okay, so I'm not going to go into huge detail on this. It's sort of a whole topic for another day. But when we think about attachment, everybody has an attachment, and language and communication develop best in a secure attachment relationship. If for whatever reason that secure attachment isn't formed, so it may be that somebody throughout their childhood has spent a lot of time in hospital away from their caregiver. Parents may have their own mental health needs, or sort of drug and alcohol abuse as well. So there's a whole sort of range of reasons why somebody may not be able to develop a secure attachment. The other thing to sort of note is that you need good language skills, or you don't need them, but good language skills help to build a secure attachment. So it does work both ways, really. So emotions and theory of mind, so that ability to know sort of what another person might be thinking or feeling, are also learnt best in a secure attachment. So those who may have an insecure or a disorganized attachment may then go on to have difficulties with their language and communication. So they may have fewer words for thoughts and feelings. And children with a reactive attachment disorder can sometimes then have difficulties with pragmatic language skills as well. So then if we think about trauma and the impact of trauma on communication, so trauma may be adverse childhood experiences. So, this could be neglect, it could be loss of a parent, abuse. Trauma may also be a single incident trauma, so from a road traffic accident. And even though that is a single incident, actually then the medical intervention that follow can be really traumatic. And if somebody experiences flashbacks and chronic stress from that event, that can also then shut down the language areas of the brain. So when we think about trauma and brain development, the brain develops sort of bottom up. So sometimes somebody who's experienced trauma may end up almost stuck in that survival mode. And then sort of areas of the brain that develop later and are responsible for executive functioning skills, so sort of impulse control, memory, and cognitive functioning, can be impacted. The other thing is that language sort of continues to develop and refine throughout adulthood. But if somebody is stuck at that earlier stage, then that can make that refinement more challenging. So what we sometimes see is that somebody may not have the skills to regulate their emotions, or to have the vocabulary to describe actually how they're feeling and what's happening for them, which obviously then will have an impact on how they can sort of communicate with others. Okay, so what we may see is that a young person may sort of misread or misinterpret some social situations. If they're stuck in that sort of survival mode, it's really easy to perceive fear and threat around you. On top of being in a prison environment, which, quite often you are under threat, and, that is really real. If you're in that sort of fight or flight response, you can then also miss some of those social cues. So yeah, quite often, somebody will say, oh, he was being rude to me. Actually, he was being sarcastic, and we didn't quite pick up on that, and that led to then causing violence or an assault on another young person because of what happened in that situation. So people may struggle to process implied meaning. So that is when sort of we're not explicitly saying what we mean, and you're having to pick up and put together some of those clues really to understand what somebody means. And then children who have experienced trauma sometimes have deficits in their narrative skills, and also some gaps in memory from their childhood, which may be linked to dissociation. So the impact of that is that they then retell sort of their story, their life story, differently each time. For somebody who isn't aware of speech language communication needs and the impact of trauma, they think, oh, they're lying, they're misleading me, without actually sort of having that understanding of there's a reason why they're retelling their story differently. And then there is also a link between domestic violence and pragmatic language skills as well. So a young person may have difficulties interacting appropriately, communicating their needs, and understanding other people's point of view. So what we then see in prison with young people who have sort of SEMH, speech language communication needs, a young person may self-harm, they may smash up. So quite often they will sort of smash the observation panel in their room, try and smash their room up, throw things out of the window. You may see violence towards sort of staff or to other peers. A really common one at the minute is going at height. So they love to like stand on the ping pong table and making threats to other people. And actually, that's not just to be difficult. A lot of the time they are trying to communicate something to us. They're trying to tell us that I'm annoyed because this hasn't happened, or I don't understand why this hasn't happened. I'm feeling this way. And it's so much easier to show it through their behaviour than it is to actually sit down with somebody and say, I'm feeling worried because this has happened. Okay, so that was a little bit of a whistle-stop tour around sort of what communication needs generally are. We're going to move on and think about, actually, if you are somebody with speech language communication needs, what is the impact of that in prison? So communication skills are needed throughout the whole sort of criminal justice system. So right from arrest through to being in prison, and especially during sort of court. So many of the boys that I work with say had no idea what they were talking about in court. They were using posh words, and they were just talking a load of rubbish. And that's, you know, it's really hard for somebody to get their point across if they have got communication needs. So obviously I'm based in prison, we're just going to focus on that for today. So in prison, you know, communication is needed to get through every day, but there are some processes and some sort of things that happen during prison that rely so heavily on communication skills. So when a young person comes into prison, they will complete what's called sort of a My Story. So that is a document that they complete with a member of the mental health team, looking at their story, their life, how people can support them best, really. Obviously, you know, some of the questions are around what things make you angry, what things make you upset, what can we do to help you if you're feeling that way. If you're somebody who's got a really limited vocabulary for emotions, that can be quite tricky. So another one is adjudications. So those are sort of a formal sit-down meeting when somebody has misbehaved sort of in the prison. So actually there, you've got to remember the event, you've got to think about and explain what happened, why you did it, what led up to that event. And then some of that conflict resolution in terms of social problem solving, making things better again. So there's, yeah, a whole range of different things. Using laptops is a massive one, actually. So each of the boys have a laptop in their rooms, and they use those to order their canteen, to arrange sort of visits with family, everything that's needed to sort of get by, really. But if you're somebody who struggles to remember verbal information, then actually being told how to use that isn't enough. So some of the difficulties that we often see are around understanding some of that really complex vocabulary that's used. It can be used day to day, and people kind of just assume that everybody understands what those words mean, and then they're used in a lot of meetings as well. So I was in the session with a boy the other day, and an officer came to the room and said, oh, if you don't have your yard now, we can't facilitate that later. This boy had no idea what facilitate means and just sort of nodded and went along with it. And quite often they won't say if they've not understood. And that can then lead to sort of difficulties further on, when that level of breakdown leads to sort of a negative reaction with their behaviour, really. So yeah, words such as like facilitate, breach, liaise, remorse are used on a day-to-day basis. They're used in court, in licence conditions, you know, and a lot of these boys don't know what these words mean and actually need somebody to explain this or to use simpler terms. So retaining verbal information, so much of communication is verbal. So going back to sort of the laptop, if you can't remember that information, you're in sort of your first week in prison, you're feeling anxious anyway, and then you almost end up isolated because you don't know how to do a lot of things because of those difficulties remembering information. A lot of boys have sort of a limited vocabulary and actually just really want to fit in with other people in the prison. So quite often they may use words that they've heard, but actually use them not quite in the right context or use them inappropriately. And it just doesn't quite work or sort of get the right meaning across. And then sequencing what they want to say. So, I was with a boy the other day speaking about an incident that happened, trying to sort of work out why it happened, what led up to it. And his story was sort of chopping and changing on different points in time in different days. And that can be really hard to follow. And sometimes can lead to a different story each time if they're trying to fill in some of those gaps. So a real big one is understanding literal language. So sometimes an officer might say, oh, I'll be 5 minutes. So I've worked with a boy who would take that literally. So he would be looking at his watch, counting down those 5 minutes. And when the officer didn't come back in 5 minutes, he's on his cell bell, he's shouting for the officers, trying to get the attention, saying, you said to be 5 minutes, where are you? Why haven't you done this? And he's not quite getting the fact that 5 minutes doesn't mean 5 minutes. It's just one of those sayings that people say, but to him, that's what it should be. It should be 5 minutes. So sometimes somebody may have difficulty understanding sarcasm. Again, they might think, oh, they're being rude to me. Why are they being rude? I need to fix that. I'm going to go and punch them. And actually, they've not quite got the fact that they weren't being serious. It's just a joke. So again, understanding sort of the social intentions of others, especially for somebody who does perceive fear, sort of more prominent than others. And in that environment, which is quite hostile, I've worked with a boy before who said somebody was laughing and he perceived that as, he was laughing at him, so he had to go and deal with it. No, he was just laughing about something completely unrelated. So somebody may have difficulties with emotional regulation. They may not understand how they're feeling. They may not have the words to express how they're feeling. And they can be just really, really quick to react. On top of just being a teenager, where sometimes, impulse control is quite poor, not as well developed sort of as an adult, you've got the impact of sort of trauma as well on that. So other difficulties we might see are around understanding some of those social rules and boundaries, especially around sort of what things you can joke about, who you can joke about it with, when and where you can joke about it. And there's so many sort of nuances around that in terms of what things are appropriate to say, when you can say them, that it's really, really complex to understand. And sometimes people do get it wrong, and that can then result in sort of a communication breakdown. And then problem solving some of these sort of social situations, and knowing sort of pro-social appropriate ways to resolve conflict or a difficulty with somebody. Quite often, if you sit down with somebody and say, right, I can see you've got this issue, what can you do to make it better? They don't know. Sort of all they know, or they have sort of previously used, is violence, and violence is a way to resolve some of these difficulties. And sadly, sort of a lot of them have lost faith because they have been let down and think, you know, even if I do go to somebody and ask for some help, I might not get it, and revert back to sort of those routes that they do know. Okay, so thinking then about sort of the role of speech language therapy in sort of the criminal justice system. So the job that I'm in is a completely new service. So I started in around December 2021. It's nowhere near where sort of I want it to be. It's prison's sort of a really difficult place to work, and things take a long time to get things set up. Where we're at the minute is that it's a flexible service to meet the needs of the young people. So I don't have a fixed assessment duration. I don't say, you know, you've got 3 sessions, and in those 3 sessions we need to complete all of this assessment, because for a lot of those boys it just does not work. You know, some people may need 5, 6, 7 sessions just to trust you and to build up that rapport. So if I go in sort of first time meeting them saying, right, we're going to try and do this assessment, they'll just shut down. You know, if you're somebody who has got really significant literacy difficulties, your whole time through school, you found really, really hard. You know, every time you're presented with a worksheet, you panic because, you know, you can't read it, you don't understand it. If I go in with an assessment, it's just not going to work. The young people need to be able to trust you and to know that it's safe, and that they're sort of in control, really. So again, it's a needs-led service, so we don't have blocks of therapy. The young people can get sort of however many sessions of therapy they need to achieve their goals, and they're always included in goal setting to make sure that it's functional and it's relevant to them and it's motivating. Because if I just go in and say, right, we're going to do this worksheet today, they're not going to do it. They have to see the value in it, really. So we do have a tiered pathway, which I'll talk about in a little bit. So the young people can move through this dependent on their need. So the tiered pathway is fairly sort of traditional in that we have universal support available to everybody, and then we have indirect support, and then that specialist sort of direct intervention level as well. So at the sort of universal support, we're really trying to develop staff training and awareness of what speech language communication needs are. So all new staff during their induction periods receive speech language communication needs training. And then we are looking at developing sort of bespoke training packages as well for the different departments within the prison. So another big area is around accessible information. So I'm completing a bit of sort of a project at the minute looking at induction. So their first sort of 2 weeks within the prison. And a lot of the boys I've spoken to say, I've signed that, had no idea what it was, I just put my signature on it, but I didn't understand it. Or they just get given lots and lots of documents that get thrown away because they don't understand it, they don't read it. And sort of, again, going back to the laptop, we're looking at how can we create sort of accessible sort of step-by-step guides to support, you know, young people coming in who may not sort of be computer literate and who need that written visual information that is permanently there, that they can then go back and reflect on and keep looking at to help upskill them until they're confident doing it sort of independently. So we also look at license conditions and create sort of an easy read version to go with their license conditions. They're really complicated. And the first time I read a set of license conditions, there were so many words in there that I didn't understand, didn't know what they meant. And, you know, if that's me, how can we expect a young person to understand that and to stick to their license conditions? So for anyone who doesn't know, license conditions are, I guess, sort of a set of rules that a young person has to follow when they're released from prison. So it may have times that they have to be home by. It may have an area that they're not allowed to go to, and sort of people that they can't mix with. And within sort of those license conditions, you've got words like breach, curfew, perimeter, excluded, exclusion zone. So they're really, really complicated. So yeah, we're working on sort of amending a lot of documents that are currently available to make sure that if you are somebody with communication needs, you can access that information well. And then in the future, looking at adapting programs that the young people can access. So within the prison, there's a range of different sort of intervention programs that are available with sort of trained facilitators. But we want to make sure that actually the way that the programs are structured and the language that is used are communication friendly. So making sure things are written down, that they know the structure of a session and what to expect. Just sometimes little changes that can make it much easier for a young person to benefit from the programme. So the next level of support is around indirect support. So making sure that communication guidelines for a young person are available to everybody working with that person. We quite often have joint sessions with the wider team. So, you know, I may work with the social worker to try and gather more information about something that's happened, and make sure that it's done in a way where that young person can contribute and can explain their thoughts on what happened. Or it might be working with a psychologist to explain a diagnosis of learning disability and what that means. We quite often go to meetings that the young person is involved in, so they will have sort of review meetings about their sentence. And I've been to some where the young person will just sort of be very quiet, they'll nod along, and just sort of say that they understand, but actually they've not taken away a lot from that. So it's making sure that it's facilitated in a way, using total communication, that they are sort of able to benefit from, really. And then we have direct support. So we may work with people who have a stammer. So I've worked with a boy before who said, you know, it's easier for me to just punch somebody if they've annoyed me because I don't want them to know that I've got a stammer, or I don't want to go and talk to the teacher because that's embarrassing, so I won't say anything. It may be vocabulary teaching to help them understand sort of words that will be used in their license conditions. And a real big one is around reflecting on incidents that have happened, and sort of problem solving, how that can be resolved in a sort of in a pro-social way, really. So, you know, I've had one recently where, to a young boy involved in an incident, what he said was just a joke, but actually to the other person it was a racist comment and was really, really offensive. But for the boy who said it, he could not get his head around why you know, why it resulted in the incident that followed, because it was just a joke, it wasn't his fault, the other person took it the wrong way, and he wasn't able to reflect on what he actually said and the impact of that. So it's working together to sort of try and teach some of those nuances around communication and things you can say, things you can't say, but also how to make things better again, and to provide sort of an opportunity to model some of those responses that he could do, or promote sort of and encourage him to think about alternative ways. So we might work on functional communication skills, things that are really motivating for a young person. It might be that they want to speak to somebody on the phone, but they don't really know what topics are okay to talk about, and what actually might just make somebody worry. And then those sort of emotional literacy and regulation skills, helping somebody to understand what they are feeling, and how they can respond to that as well. Okay, so just sort of thinking about some of that in more detail. So we've got a young person with a diagnosis of a learning disability, who is desperate to fit in, just wants to be like everybody else. And he's really, really good at masking these difficulties. So he will nod at all of the right times. He will laugh along with everybody and act like he gets it. He will say, yeah, I understand, and can repeat back exactly what you've said to act and to show that he understands. But when you dig a bit deeper, actually he's not got that understanding, and he has got a limited understanding of sort of social appropriateness. So what things you can say, what things, you know, may not be okay to say, and when is a joke taken too far, a bit like what we spoke about earlier. So yeah, this young person was involved in an incident with another young person, and again, unable to understand why the incident occurred. So using sort of drawing, writing, sort of little prompts and pictures to support that discussion, we were able to work out actually, okay, what happened first, what led up to this incident, and provide sort of a scaffold to think about how the other person was feeling in that moment. You know, how would you feel in that moment? Because this is a boy who hasn't got that ability to put himself in other people's shoes. So it's when you're trying to reflect and to encourage some of that sort of conflict resolution skills, he was adamant that nothing wrong had happened. So yeah, it's really important that we do support some of these difficulties. So some of my work is around specific work around actually understanding jokes, what topics might be offensive, you know, who is it okay to joke with, when shouldn't you joke, when can you joke, and then sort of those opportunities to reflect and to develop his problem solving skills as well. And it's actually it's motivational for him. He wants to do that, and he wants to make sure he's not putting himself in those situations again where he may sort of become involved in incidents, and to sort of avoid any future conflict. So that is a little bit of a whistle-stop tour, really. I'll hand it back over to you, Andrea.
Oh, that is absolutely amazing, Lauren. Thank you so much for all that information. And my initial thoughts are, you know, sort of, wow, what an impact trauma, attachment, the person's environment have on speech, language and communication, really. And wouldn't it be great if we could just highlight that so widely to that's the impact. And it sounds like such an interesting role, a new role, and very challenging, but so interesting for you to undertake. We've not had any comments or questions during your presentation. Does anybody have any now that they want to type into the chat? While you're having a think about that, I'll launch the poll, which just gives us a little bit of feedback about the presentation today, and also gives us any information about sort of future presentations that you would like to hear. I've just got one question for you, Lauren. You mentioned a lot about working in a team. Who's on your team with you there, and who are the key people you'd say that you need to get on board in your quest for promoting knowledge about this area?
So within my direct team, we have clinical psychologists, substance misuse workers, mental health nurses, and a drama therapist. But I'd say actually, I think the biggest impact is around other people's knowledge in the prison. So sort of, we do have like a conflict resolution team who work specifically with the boys if they've had sort of any incidents to repair that damage that's been done. So yeah, I'd say trying to get involved with the wider team who actually work really closely with the boys to develop their understanding around communication needs and how to sort of work best with any of the boys who have communication needs. It's probably more important really than the actual team that I'm involved in. Yeah,
it's like I take it that that's a huge network of people as well, isn't it? It's a lot of people that you need to get that message across to.
Yes. Yeah, work in progress, and it's really hard in the prison because, you know, there's a lot of staff shortages, which means actually they're just trying to get by day to day, and although they'd love to be able to implement all of these sort of training opportunities and sort of information that they've learned, it's actually really hard, and unfortunately a lot of the day is just about making sure that they've had a shower and that they've gone to education.
Yeah.
And it's quite sort of focused on day-to-day management rather than sort of that wider trauma-informed approach, which we are sort of trying to implement. We've got something called Secure Stairs, which is being implemented across the whole sort of youth custody estate. But yeah, a work in progress.
You've had lots of comments saying thank you so much. It was an awesome presentation. Sounds so interesting. We have got one question, which is, do you find people are receptive to your advice and take on your recommendations when you're working with the young people?
I would say it depends on who we're giving the advice to. It can be a real struggle because I think people who are on the front line at the minute just have not got that capacity to actually, you know, take on board some of that advice. So it's kind of picking and choosing my battles at the minute. You know, there are some really amazing people who work in the prison who are quite receptive to the advice and do want to implement things. Yeah,
yeah, could you just click on the side for me, Lauren, so I can talk to the rest of the presentation because you've got control.
Yeah.
Okay, so yeah, I don't think we've got any time now for any more questions, but the feedback's been amazing in the comments, Lauren, so that'll be saved along with the presentation. So I will just remind everybody that the video, all the training videos are available on our AT Therapy YouTube channel, and there's lots of other ways of keeping in touch with us. And if you just click on another one, Lauren, then we can just tell you about our future trainings. We've got Makaton training coming up and play included training coming up, which are face-to-face courses at our Oldham office. And all of our courses are available to book on Eventbrite. And if you click on one more for me, Lauren.
Oh, hold on.
Our next webinar is in July, and you can book and follow this course on Eventbrite, but that's about supporting young people with complex communication profiles in a mainstream school setting. So it'd be great if people could share that information and book on that next webinar. So all I want to say, Lauren, is thank you so much for coming back to AT Therapy, for even if it is just for an hour, to share your knowledge. And it'd be great to catch up with you at some point in the future when, you know, you've been able to put some of your amazing plans into place and see the impact that your service has had at the Young Offenders Institute. So thank you very much. I'm going to stop recording